professional organizations and other entities. So I think the discussion of how guidelines are developed would be a good one to have. Mm-hmm.
All right, Chris.
At various times in the past, we've talked about the Agency for Healthcare Quality and Research, AHRQ. I'm not sure where it sits. Is it a HRSA? It's separate from HRSA? But again, I think an agency like AHRQ would be helpful in respect to developing guidelines. I mean, that's part of their mandate, is to improve the quality of care through ensuring that these things are disseminated to us in the communities when we're caring for patients. So just like there are the U.S. Preventive Services Task Force for preventive services, it would be very helpful if an agency like AHRQ were to be involved in creating guidelines or disseminating guidelines in the future.
I think it would be worth this committee thinking about a short presentation on the discussion of guidelines and guideline development and how the many different ways that they are developed. There are a lot of different approaches.
Yeah. If I may ask a question and make a comment, states have gone on to develop guidelines, New Jersey, Vermont, and several others, and I don't mean to be accusatory, but the point is that there are sometimes guidelines written, and you don't always have to rediscover the wheel. Rather, it's to take the best from what's out there. And I think the challenge would be that I don't know if this committee would be the right venue for writing guidelines, having written several of them. But I think, I'm sorry?
No, are charged to say that they're necessary.
Well, then you're anticipating what I'm saying. Then.
Because the IACFS has said they would write guidelines with anyone who wanted to partner with them at any time.
Yes.
We have an expert group, and no money to put the group together. So,
Mm-hmm.
so is there a grant mechanism we could go to bring a collaborative group together to write these up?
Well, that's what well, you asked my question. I was going to ask, what I was going to ask is, process is important, and having written 3 or 4 national guidelines for the agency, I know I always get the name wrong, Healthcare Policy and Research, that I knew HART, takes major responsibilities for that. It seems that and it's very organized. I've been the chair of one with Wafra Sadra on the HIV guidelines. It would be a mechanism to standardize treatment at this point in time, especially with the exciting things going on, because it takes about 2 years to write them. So if we started now empowering a group, you know, maybe a year and a half, 2 years, you would expect a document back. I had a second question besides guidelines and writing guidelines and how important they are and who does them, and that is, the last time we were here, I thought you had talked about how there was part of either your agency or again another agency that would strengthen and support residency training that as one of its goals would be to include awareness and functions around chronic fatigue syndrome, and that there was a way of programs enabling themselves to build up their residency programs through funding mechanisms. Maybe I had it wrong, but that wasn't you, I could tell by the face.
Yeah, I'm not sure what, I mean, the one thing we did was we had shared the CDC website with the AHECs, the Area Health Education Centers, and just basically inform them of that information, and then of the importance of chronic fatigue. That's that basically puts chronic fatigue on their radar. Then it would be up to entities to request training from those AHECs in chronic fatigue in order to sort of generate that training that to generate the response, basically.
I think that's what
and that's at this point, what we know is that the AHECs were aware of it, but at this point it's difficult for us to know what kind of response they've gotten in terms of actual requests for training. At this point, it's not clear to me. Now, if some of you are familiar with having asked and not gotten a response, that would be of interest to me, but at this point I'm not clear. Mm-hmm.
Okay, last question, because we do have to move on with the agenda. Len? Jason?
Just to pick up on the point you made about the presentation concerning guidelines, if that was something that we would want to put on the agenda for the next meeting, can you guide us as to who you'd recommend we would invite for that presentation? What organization, which agency?
We'll pursue that at the departmental level. It would be hard for HRSA alone, but that's our responsibility as the staff and SAC DFO or whatever to this committee, is to identify those resources. And if it's a tag team, if it's 2 or 3 agencies, that's who we'd have. If it's one agency, we'll find that.
Thank you.
And we'll benchmark that if that's the committee's interest for the spring committee.
2 meetings ago, we talked exactly about that organization, Healthcare Policy and Research, to possibly consider writing guidelines and setting that, because that's what they do. And maybe we could invite them to the next meeting and actually present how they would do that.
Their guidelines process has actually changed significantly since they were known as the Agency for Healthcare Quality or Healthcare Policy and Research, because their budget was zeroed out because they wrote a set of guidelines Congress did not like.
Oh, wow.
And they have rebuilt and are, focused on a bit different process. And they still are a very, very small agency, but we still need to explore and understand what that process is, because maybe there are guidelines, capital G, and there are guidelines, small g, that represent the weight of the science, and yet wouldn't meet the test for, what you would really call evidence-based. It's the best we know. And it's interim, because you have to start somewhere. So, but let's explore that. If the committee would like to, flag that for an issue for the spring meeting, we will note that moving forward.
I think that's a good idea, Jason. I'll make sure that gets in. All right. Next on our agenda.
We have a public comment. 1 hour. Mark, do you want to say something real quick?
Yes, I want to say something very quick. I think that AHRQ has been invited at a previous meeting of this committee to present, and I think that there was also a time when they actually did, at the request of this committee, put together an evidence-based document about what was the state of the knowledge. Now, that was some years ago, and it's possible that there may be some new, value in revisiting that, but they actually have participated already in the past in our committee. Eleanor, I think, has something to say about this.
Nobody can hear you, Eleanor.
They produced that evidence-based report in 2000 when at the time of the last State of the Science meeting, and I would imagine that if procedure is still the same, they would produce another evidence report before the next State of the Science meeting.
That's what I was alluding to.
And the next
that's
State of the
available
Science
on
meeting,
on the NIH website.
and the next State of the Science meeting is 2011.
Right.
So work would need to be underway imminently.
Right.
Okay.
Okay.
We'll follow up and see what we can learn.
Okay.
Wanda, just one more comment. If you do bring experts together, and I know the VA doesn't fit under the HHS umbrella, but they also provide a lot of
Neither
care.
does Social Security, but they have
Yes.
graciously joined us
Well,
because
maybe
they
we
know
could
how related.
graciously bend the VA to come too, because they're just as in need of
Yeah.
these kinds
Great.
of things as anyone
So
else.
noted.
All right. We're going to have the next hour devoted to our testimonies by the public. Do you have the list?
Yep. Okay, we have reserved an hour for public comment, and even though we're now almost 15 minutes late, we will preserve that hour for the public comment, because that is a critical part of public meetings. So our first speaker this morning is Mike Desson. Mr. Desson? Great. And let me just review as well. Excuse me, sir. Everyone has 5 minutes. There's a red, yellow, green light indicator. With a 2-minute warning, the yellow light will come on, and then 5 minutes are up when the red light comes on. And again, if you've not presented your comments in writing, please make those available to us so we can put them on the web. Okay, Mr. Desson, please.
Thank you. Hi, my name is Mike Desson. I've had myalgic encephalomyelitis for 14 years, a disease that is unjustly named chronic fatigue syndrome in the U.S. I had one of the most severe cases of ME/CFS ever recorded, with subsequent remission. At the worst stage of my illness, which was about a year ago,